sound on?
Not yet. Turning the sound on now. So much for bumper music. We don't have time. That's okay. Welcome to Chat with the Docs. I'm Mo.
I'm Dr. Noel.
The masked Cairo.
And Becca.
Dr. Rebecca. I can call you that, right?
Sure.
I mean, it's fun to have someone that we can call that here.
Yeah.
Dr. Becca is our illustrious guest host that we talked about last couple weeks. She's a physical therapist here in town, and we are tickled to have her with us. We're running late today, and I apologize for that. We're running late because we had some emergency type patients that we had to take care of. You had a neck to put back together.
Yep. And that was when we're co-treating too.
Yeah.
Worked out good.
So we are. Mercy, settle down. We just get started, and this is how good our show is. Well, this is just how kind my wife is. She watches it. Mercy's already asked, no show? Because we're late. It's a snowy, blustery day. You braved the snow. We had to, because this is where we hang out. You braved the snow, and thank you.
Still going.
Did you put rubber bands on your tires and pretend they were chains?
Are you in town as well?
Mm-hmm.
Cool.
So you are a PT,
Mm-hmm.
because this is the age of acronyms, right?
Yeah.
You are a PT, a physical therapist, and a doctor of. Tell us about what a PT does, because most people don't have a clue.
I didn't really understand fully until I got into it myself. And there's so many things that therapists can specialize in and treat. The list is extensive. But in general, our goal is to help people improve their function and engagement in life. We address people's complaints of pain or discomfort. And we really seek to empower people to use the tools we give them so that they can have control over their situation, whether it's a pain situation or a function situation. And our treatments include exercise and manual therapy or hands-on type stuff, and posture education or positioning, sometimes vestibular kind of interventions, and modalities we're frequently known for, so traction, ultrasound, laser, and iontophoresis kind of things. And I'm lucky at East, we have a pool, so we also treat people with aquatic therapy. But I specialize in pain and chronic pain, and I became a therapeutic pain specialist from the International Spine and Pain Institute a couple years ago. And one of my favorite skills is helping people by de-threatening their pain situation and using pain neuroscience education to teach people about pain and what they're going through with their experience and how pain works, so they can be so smart they can overcome it. And
So you're putting out the fire, but you're also empowering the patient so that they can self-care in the future. Okay.
Working yourself out of a job, just like you do.
that's the goal.
I told you she was cool.
Yes.
And this kind of goes back to what you guys were talking about last time. We both had some aches and pains, and having pain is normal. It's a way for your body to tell you something's going on. But living in pain isn't.
Mhm.
So because of our pool at my
Wait a minute. You mean you actually watched this show?
oh yes,
Wow! We is high class.
I'm one of those viewers,
Wow!
and I learned some things every time.
Wait a minute. Mercy's one. It's either Mom or John's not telling the truth about
Yeah.
watching.
I don't know. We'll leave it be.
So you do manual manipulations. You have other modalities that you do, gizmos that you bring in, lasers and ultrasound and things like that, and traction devices. Do you get very many confessions from the traction devices, or do you have to resort to other more advanced interrogation techniques? You don't have to answer that.
usually people think the Pilates reformer we have looks like a torture device, but once they're on it, they're usually pretty happy.
In California, they paid big bucks to do the Pilates thing. How much do you work with your patients on looking at their work environment and giving them tips on things that they need to change in their work environment to improve posture and hopefully reduce re-injury?
We definitely discuss that when I'm working with people who are seeing me for a work-related injury or their work is maybe contributing to that. But I'd say at my age range is a big variety from like 4 weeks old to 100. So that is into the primary focus for most of my patients. And there is like work conditioning, and then there's people who actually go to people's work environments to
Ergonomic assessments and
Yeah.
stuff like that.
So that isn't something I specifically do, but we go over things are at home. People are talking about how their workstation is set up, so I might give them some suggestions on how they can modify.
Now, tell us about your work with Parkinson's, because you do some really cool stuff for Parkinson's patients. And Parkinson's is one of those things that someone gets the diagnosis and you're not, 99% of the time, you're not going to be able to stop it, but you can at least slow it down. What is it that you bring to the table for the Parkinson's people?
A combination of exercise and neuromuscular reeducation, which is my favorite intervention,
Yeah.
teaching people to move new ways. But I am LSVT Big certified, and that acronym stands for Lee Silverman Voice Treatment. And it was named for a patient who had Parkinson's, and her family complained that she was talking so quiet they could hardly hear her. So she was working with a speech therapist who worked on volume and helping that patient with volume as one simple thing to think about was a way for her to then be more articulate and easier to be heard. And that transitioned or overflowed into the movement treatment that PTs and OTs can do, where we focus on high amplitude, big movements that have a focus on how it feels to move that way. So it's a lot about the internal focus as opposed to using mirrors or something like that for feedback. And the protocol for this is 1 hour sessions 4 times a week for 4 weeks with a therapist. But the patient is expected to do 2 hours of exercise a day. So they have to go home and do the same program after therapy or before, depending on timing, and then twice a day the days are not in therapy. And the importance of that is the repetition. So your body thinks you're moving normal, but really you're moving small. So we have to work on what it feels like to move big all the time. And in the treatment program, there are 5 maximal daily exercises, and sitting and standing, and then there's 7, and then there are 5 functional component tasks that the patient and the therapist decide together based on what's difficult. So if buttoning or putting on your shoes are things that are difficult, or opening a jar, those are things that we would work on every single session. We always work on walking and a hierarchy task. So something that is more complicated, like walking up to the kitchen table, pulling out the chair, sitting down and scooting in, might be a hierarchy task that someone has trouble with. So it's a progressive thing that you work on over time, and it takes time to adapt, but it's pretty cool because sometimes even the first session, people walk out looking better until they get to the front door, and then they look normal again. And that's why it takes that repetition to integrate a new pattern.
You're making new neural connections.
Mm-hmm.
You're getting the brain to reconnect with all of those tissues again.
Mm-hmm.
And that takes time, and that takes repetition. That's fascinating stuff. When I was in school, we had a doctor of PT and a doctor of Oriental medicine who was one of our instructors, and he would always bring in. He was big on Qigong, and he would always bring in studies for treating Parkinson's with Qigong, and it's very similar type stuff. But to see something where they've created a standard of care using some of the same principles that have been proven in these peer-reviewed journals. That's really exciting.
And those 7 exercises are developed based on Tai Chi and those bigger body postures. And it's a good workout for me and the patient because we do them with the patient.
That's really cool. Now, what are some of the prerequisites to become a physical therapist? Because I always, before I got into medicine, I always thought a physical therapist is some guy named Andre from, Vienna, talking like he say, "I am going to put you back together today." You're a gymnast, so you fall into that category.
I fell into I like science. I
Uh-huh.
like knowing how things work and why. And I like helping people. And I like teaching. And that's probably one of my favorite parts of my role is being a teacher for people of all ages. But I didn't even know what I was getting into. I thought I was going to do sports PT. And then I realized I don't really know anything about sports. And so treating just
Welcome to the club.
the normal people are my favorite.
Yeah.
People my parents' age, people, just living life.
Yeah.
But that doesn't answer your question. So your question was what it takes to get into it, and it's undergraduate degree in some related field like health sciences, biology, psychology, and then it's a 3-year graduate program. And some schools do a 6-year combined fast track. So that's what I did.
Very
So I
cool.
wanted the least amount of time in school relative to my time working thereafter.
Qualifications.
Sounds like our kind of gal. My kind of attention span.
My aunt is actually a physical therapist as well. So yeah, I was wondering too, like, if you had a moment that was like, this is what I want to do. She had scoliosis. She did a Milwaukee brace, ended up having to get surgery, but she did so much physical therapy that's what drew her into the field. So did you have like an experience like when you were trying to figure out which one you wanted to go to, like, yes, this is the one I want?
I wanted to be a teacher first for first grade.
Okay.
And then the athletic trainer was able to diagnose the difference between my soleus and gastroc strain, and I thought that was incredible.
Yeah.
And I knew I didn't want to tape ankles because at the time that was my perception of athletic training, which I know is not the case, but as a high school sophomore or whatever.
Well, I know what you're exposed to.
That was my perception. So I was like, oh, this is cool. And my cousin was going into PT, and I said, I'll do that.
No, it's cool. So you did have
pretty-
personal experience then.
Kind of. So nothing traumatic. Like a lot of people have surgery and things, and I didn't have therapy until I had been a therapist for 4 years.
Then you got to have the benefits of it.
I tried to therapy myself, and it didn't work. So
It's like adjusting myself. That doesn't work either. So
sometimes you need that extra set of eyes and hands.
Yeah.
So,
So this is cool. If you want to be a part of the show, or if you have a question that you want a real live on the ropes physical therapist, or if you're a hipster, a PT to answer, give us a call at 608-314-8791. Carrie's waiting to answer your call, and she'll get a hold of me via the chat and let us know that you're waiting. Or if you just have questions for chiropractor or an acupuncturist, give us a call, 608-314-8791. And just a disclaimer, because normally we're not doing our cicada impersonations. Doc Noel's wearing a mask because our studio is small and we can't get the 6-foot distance, so
I'm the space.
she's the space.
We're compliant.
We're compliant. So let's go, since time is short, let's do the conundrum let's answer last week's conundrum.
Okay.
Are you ready?
Go for it.
Okay, so last week's conundrum was Carl B. Krasinski was experiencing pain in his right knee described as a dull ache. My sisters once described me as a dull ache. He also complained of chronic low backache. Carl was terrified of acupuncture needles, but his acupuncturist, Dr. Glenda Gesundheit, she a good picture, was confident that she could treat his ailments using herbs. What organ pattern did Dr. Gesundheit focus on?
Kidney.
Oh, you! You should wear a mask more often. This is very good.
Maybe a hat too next time.
A party hat?
No cowboy hat. Then I look like
Oh,
a
I was
bandit.
thinking party hat
Then
or
I look like a
aluminum hat.
bandit.
Yes, but that was the organ. But do you know the organ pattern?
I just wanted to read the organ. Pattern? I don't know the pattern.
Well, you're halfway there. So you wrote half of the answer on the underside of a hood of the 1967 Mustang.
Halfway right.
Halfway
full.
right.
Glass half full.
Yes, the answer would be kidney shu or kidney deficiency.
Okay.
Deficiency of what? Well, kidney qi deficiency.
Okay.
So in Chinese medicine, whenever someone's coming in with low back pain, lower extremity pain, especially knees, you always look at the kidneys. And it's going to be either a kidney qi deficiency or a kidney yin deficiency. Or if you want to just cop out, you say kidney shu, which is why I was doing it that way so that you could go.
Did anybody get more right than me?
No, nobody wrote in. Both of you did not write in. I'm telling you, you could win something.
How many weeks has it been then?
You know, you could write in too.
I thought about it. I'd have to do some research. I don't have any background
You don't have-
knowledge on this.
Well, I'm sure time is short too, because you're pretty packed. So then the next question is, if she says, "Okay, you chicken, you don't want to get," first she's going to put the little ruby slippers on the guy. Then she's going to say, "You don't want needles? Well, I'll take care of that. We'll give you some herbs." You didn't know Glenda the Good Witch had a Brooklyn accent, did you? The question is, what herbs would she give him? If it's more of a qi issue, probably Xiaogui Yin, which is, actually, no, that would be more of a yin issue. That's restoring the left kidney. You would either do restoring the left or restoring the right, which would be the classic herbals, just for throwing some quick tonifying strength at either the yin or the qi aspects of the kidneys. If it's more of a kidney qi deficiency with, say, some liver issues involved, then you'd be looking at a Duhuo Jisheng Tang. And yes, I wrote it down here so that I wouldn't mess up the pinyin. But those would be the classicals that you'd probably be looking at. Then again, one of the beauties of Chinese medicine nowadays is they're doing more with patent formulas. So some of the like the evergreen chronic back pain type formulas, they're focused on qi strengthening. So that would be last week's conundrum, and in a few minutes we will do this week's conundrum. Hero, you got to help us out, man. We got to get this out there. We need people to write in their conundrums. How was that for a Shatner impersonation?
I pretty much had that kind of pain that you worked on me last week when I was sweating on the table.
Yeah, you did. And
It hurt.
yeah. It's time for our first question. Do you want to read it or do you want me to?
You can.
Aaron with an E in Milwaukee. So if it's an E, is that a female Aaron?
That's how I've always known it.
And if it's an Aaron with a double A, it would be
Aaron.
a Haron in the Hebrew. It would be a male. So Aaron with an E, unless you're trying to just slip us a Mickey, in which case we got it wrong. Why do I always have bad reactions to medicines and supplements? It's like I always have the opposite reaction that I'm supposed to.
I know this one. Mold.
Most likely. Or it's most likely mold. Yes, you're right. It's most likely you've got mold in your environment, mold in your diet, mold. But you do want to be checked and see if you have, what is it, the MTHFR gene being expressed. And that can be expressed as a result of chronic infection or the mold exposure. But Aaron, that's probably what's going on. If you want to have that MTHFR gene checked, you should see your doctor, your naturopath, or somebody that can write up those orders. It's probably the mold issue, though. I would start there. I would see about trying to get somebody that can walk you through a protocol for reducing the mycotoxicity within your body. Number one, determine whether it's an internal infection or whether it's environmental. If you were on the phone, we would ask some follow-up questions about your home environment and work environment, but alas, you wrote in. Collective sigh. See, this is what it is when you're a low-budget YouTube show.
We're good. Who cares?
Why don't you read Bill?
Me?
Yeah.
Okay, Bill is from Chicago, Illinois. 56 years old, high stress job. Groin pain that gets worse when I'm at work. Doctor says lymph node is swollen, but has checked it out and says no cancer. Do you guys have an idea?
Number one, I'm going to say Bill's rather a type A personality kind of guy, wouldn't you? Just by how it's worded.
Yep. Right to the point. Well, he's from Chicago though too, so that's kind of goes with it.
I have an idea on this. Do you have an idea on this? Do you have some direction that you would go if someone came into your practice like this?
I mean, certainly checking strength and balance of musculature, pelvic obliquity, possibly, and curious if there's anything else that's maybe contributing to it outside of the sitting at work. It's perpetuating it.
Lymphatic stagnation, maybe?
Well, yeah, all of this stuff. What I see as a Chinese practitioner, I look at this and I say, high stress job, and it gets worse at work. And we know we've got a lymph node that's inflamed and enlarged. So then I look at where does that inguinal lymph node drain from? That's draining from the mesentery of the gut. So there's inflammation in the gut. And if this is weird thinking, then that's just how my little pea brain trained in Chinese medicine works. Then I look at what patterns would be affected by stress. Well, just off the most common would be the liver invading spleen and stomach, where if you're a classical 5 elements person, wood insulting the earth. How's that? So, Bill, you're probably a very high stress, and it's getting worse at work because of the stress issue and that liver messing up and causing problems with that pancreatic function. And so now you've got an autoimmune response in the small bowel. All of that lymph that's built up in the small bowel from that inflammation has to drain somewhere. It goes to that. Did you say left? You didn't say left or right. Good. I don't have to make an orthopedic surgeon joke.
I hit the wrong one.
Make sure you draw a big circle around it with a Sharpie. I think that's probably what's going on. So I would look at doing some liver harmonizing herbs. Number one, if you're in a high stress job, you're in downtown Chicago, you're probably an exec of some type, you'd probably start doing something like a Jai Wei Xiao San, which is really fun to say. Say it with me. Jai Wei Xiao San. You have to have the maniacal laughter afterwards. It's just a natural. So I would probably put you on a Jai Wei Xiao San and possibly a Gui Pitan just to help strengthen that spleen function. Then again, depending on some other things, we may have to take a look at some SIBO possibilities. How much gas and bloating do you have? all of these things play a factor. If there's a lot of gas and bloating, if there's pain up
Is he
here,
sitting all day that it's putting pressure and pushing
Right.
through?
it could be a SIBO situation, in which case we're going to need to use some appropriate binders and some appropriate probiotics. Orthomolecular has a really good one. I can't think of the name of it. Sorry, guys. A very good probiotic and binder put together. And
It's
it's
not orthobiotic, is it?
orthomolecular.
Well, I think that might be the name of it.
Hold on.
Orthobiotic.
Totally
I think it's
unprofessional.
something easy like that, though.
I have a-
Orthobiotic.
Orthospore.
I
Orthospore.
wanna say they got orthobiotic too.
Orthomolecular's new Orthospore. And
Okay.
the chemistry of it is phenomenal.
That's a different name. I don't know if I like that name.
Well, they're using spore probiotics. And they, when I used to hang out at the Natural Health Expo out in Anaheim every year, you always had the cutting edge stuff that the next year everybody was going to be doing. And Orthomolecular was very, very sharp in that spore probiotics came out 5-6 years ago, and suddenly everybody starts doing it. But Ortho waited to see what the weaknesses were within the formulas, the established formulas. And they said, these are the weaknesses. How can we make this work better? And so then they came up with some appropriate binders that will basically chase the bad bacteria out of your small bowel over the course of 3 to 6 months. Get that small bowel working properly and cleared of the infection. It's brilliant, the chemistry involved. And I'm geeking out, aren't I?
Oh, I hadn't heard of that one, so that's pretty cool. I'm gonna look at that one too.
I did it again. Here's one for you. Do you want to read Mark with a C?
Okay.
Mark, I know this. I know two personally. I know two Marks with a C. One is an Olympic level karate dude out of Madison. He teaches karate and jiu-jitsu. Sweet guy. And then one is a patient of mine, Mark with a C.
Cool.
How many Mark with a C's do you know?
I don't think I.
It's a rarity. I'm geeking out. But now it's just dumb geeking out. Go ahead.
Okay. Mark from Tulsa, Oklahoma says, I hurt my back last summer. Doctor says blown disc. He gave me pain pills and muscle relaxers that I didn't want to take due to some addiction problems in the past. I was going to a chiropractor, but I just can't get it to go away, and I don't know any acupuncturists. You guys said you have a physical therapist coming on. He can suggest any exercises or stretches that might help. This disc is L4, L5.
Mark with a C. We have Dr. Rebecca.
Mm-hmm. Well, I think the biggest thing is, what does your pain feel like and where? And if it's going down a leg, one or both, and if so, when does that happen, in what position? If it does go down a leg, a lot of times we look at, is it better when you're standing and walking versus when you're sitting? And if it's better standing and walking, a lot of times laying on the stomach can help, or being on the stomach on the elbows can help. And if it's just back and local, the multifidi is most commonly the muscle strained with like a lifting, twisting sort of injury. So doing core stabilization exercises, usually a neutral at first, and then working into doing core stabilization in more dynamic patterns, like stuff that will allow you to be able to twist again without aggravating it if for example, that was the way you got hurt.
Would like a bird dog exercise be like one of those that would be more dynamic that would go with it?
So that would still be in neutral,
Okay.
hopefully, if you're doing it correctly. Most
Yeah.
people can't control it very well at first. But like I like to start with something like a Palloff press, even if like standing is a good position, when the resistance coming from the side and you press out, it's an anti-rotation because your body's trying not to rotate. And then as long as that's not aggravating, you can increase the resistance and then eventually work into like a chopping with squatting, kind of more functional thing that you might do in your daily life.
Cool. If and we talk about this a lot, if your current practitioner can't cut the mustard on something, it's not a bad idea to try to get a second opinion. I wish you were closer, Mark, because we got a lot of talent in this room, a lot of anointing from the Lord. You would be the only chiropractor that I would, at this point, allow near my neck. And so I would strongly suggest, take Dr. Rebecca's advice. If you can get somebody to let you try PT, but use as many modalities as your practitioners can put together. Put a team together. You don't have to be OJ to have a team of, in this case, not law practitioners, but medical practitioners. Here you come and you get the two of us. Can people that are not associated with the Mercy system see you?
I was wondering that too, like with referrals and that.
Yeah, insurance, it kind of depends on contracts, but like we treat with Medicare and Medicaid too.
Okay.
So pretty much if you're not an HMO with another health system.
So
The
if you're in
insurance
Janesburg or near Janesburg, you can, whether you're in the Mercy system or not, you could get an appointment with Dr. Custer over at Mercy East. You could get the three of us tag teaming and working on you. The idea would be to work together so that we could cut that treatment time. So instead of a 6-month treatment time, 1.5 to 3 months. I mean, it's possible.
I'd hope that someone with his situation would feel better in like 4 to 6 weeks. Maybe sooner.
Depending on the severity of the issue. Now, and what did we always hear when we were kids? And you'd hear somebody with a blown disc, they were shot. It was the way it had to be. And now that we're grown up and in medicine, we know that a blown disc, it's treatable. Now, we have JC on our one and only line. JC is, she had COVID in October, still cannot taste anything. Is there anything she can do? Hello, JC, welcome. You've reached Chat with the Docs. Thank you for calling. You are our first real live on the ropes caller. This is cool.
Perfect. Awesome.
We should have guest hosts more often.
Yeah.
So JC, you had COVID in October. How did you fare?
I did okay. I really didn't have a whole ton of symptoms. No fever, which I found quite strange. But yeah, no fever, no. I'm a little tired, I guess, a little fatigued. But the main thing was I lost my sense of taste, and unfortunately, still don't have it back.
So does this mean that you get up in the morning and have this strong urge to put on a green tweed jacket with plaid shorts?
You know, if that
Oh,
were
not that
something
kind of
I could
taste.
tag, I'm willing to do anything at this point.
Okay. So your sense of taste has been out of commission since October.
Yes,
How is your sense of smell?
fine.
Are there any areas of the tongue that you have sensation on?
So, no one really believes me when I say this, but it's almost as if when I swallow, it's as the food or whatever it is going down my throat that I can get like a hint of something. If it's super spicy, if it's super sweet, that's the only time I can really even have a sensation. But there is nothing, like right now I'm chewing gum, nothing. Nothing on my tongue at all.
Well, the bright side is you can eat at Denny's without any trouble.
So true.
When you're dealing with something like this, one of the things that I have come across in studying the COVID and its relationship, its attack on the sense of smell and taste, is those cranial nerves. So in Chinese, we look at these infections as though they're wind heat or wind cold infections, and those will affect that back of the head, that occipital region and down the neck. So it would follow that you could have an effect on the cranial nerves. I would want to start you on some herbals, and I would definitely say you need to get on some acupuncture. The sooner the better. From what I'm seeing with the studies and the research, the sequela on the cranial nerve affecting smell and taste is sort of like the sequela from a stroke, where the sooner you hit it, the easier it is and the quicker it is and the more likely it is that you'll recover.
Okay.
Now, I don't know about you ladies, but I'm not finding any research on, some exercises that you can do to try to recover that. I think the reason that you're getting some sensation as it's going down the throat is probably more related to sense of smell, and some of those particulate going up and being exposed to the olfactory receptors in the schnoz. And I know, Doc, schnoz is not a readily accepted medical term. Don't judge me.
Well, and it's a virus. It takes time for a virus to work its way out. I had bronchitis years ago, and I thought I was getting adult asthma because it was probably like 3 or 4 months that I still had that lingering cough.
And that brings up a very interesting thought. JC, where are you located?
Where do I live or where do I work?
Close.
Where do you haunt?
I live in Fort Atkinson, Wisconsin, and then I work in McGuanago, Wisconsin.
Okay. I would say try to find, either come down here and we can start working on you with some NAET, because when you clear the body's allergy to this virus, if there's any lingering infection around that cranial nerve, you'll probably get the recovery of that sense. And you can do that with something called NAET, Nambudrapad's allergy elimination technique. And I would say either do some research and find out who in the neck of the woods of McGuanago does NAET out there, or come down here and we would give you some NAET, probably couple it with some acupuncture and some herbs.
Okay, would it matter? Because I just did get my first dose of the vaccine with being a healthcare provider.
Yeah.
Does that make any kind of difference in the treatment, or is it completely unrelated?
It's not unrelated. It could actually, and I know I'm going to get in trouble and we'll probably get kicked off of YouTube for saying this, it could exacerbate the issue in the short term. Okay. But as other patients that have come in after getting their vaccination, appropriate intervention with the acupuncture can really make a huge difference with limiting any impact and side effects of that vaccine.
It's amazing.
What I'm particularly seeing is it's the second time around. I've seen a number of healthcare practitioners who they go in for their second round of the vaccine, and it is a booger, if you would allow me talking like a sailor, a junior high sailor. And that second time around, it's rough. Anxiety attacks, shaken, feeling sickish, fluish, body aches. Those symptoms I'm seeing over and over with the same group of people. Does it make it less likely that we'll be able to recover your sense of taste? Not necessarily.
The nerves are healing.
the nerves,
Nerve damage.
the nerve damage that's there has the potential to heal. What do we know about the nervous system? It's plastic, which means it can be rerouted, it can be healed. The interventions that I would do would be acupuncture, herbs, and then the NAET.
What about like fish oil, like for anti-inflammatory, something just basic like that?
Well, yes, and to do a therapeutic dose of a good fish oil, don't, JC, promise me you won't get your fish oil at Walmart.
I promise.
Okay. Orthomolecular brand, again, I love Orthomolecular brand. They've got great
I
products,
take that one.
good, clean products. A therapeutic dose of fish oil, you're going to want around 4,000 to 6,000 milligrams of fish oil. It's a lot, but that's what you're going to want for a therapeutic dose. And that shows a lot of impact on the nervous system. So that's something that you can do if you can't get to a practitioner who can help you. That's something you can try. The old curcumin trick. Curcumin's great because it lowers inflammation levels throughout the body. There's a number of things that are out there that are good at lowering inflammation. But for something that's this significant, you're going to want to get with a practitioner.
Okay.
You're going to want to partner with somebody on this.
Good to know that there's hope.
There's
I'll be getting my sense of taste back.
there's always hope, but and especially after the holidays, now you're going to want your sense of taste back because you don't have to worry about tasting the fruitcakes anymore.
Well, she's got fork in the road
It's just a
restaurant.
little late over the holidays, not eating as many cookies, because what's the point of a cookie if you can't taste it?
That's true. That's true. JC, I hope this helps. If you have any further questions, go ahead and give us a call. I can schedule a time where we can sit down and talk even further if you'd like. And I'll just do that out of the kindness of my heart.
Sounds amazing.
Okay. Did you want me to put you on hold so you can get something scheduled with Carrie so that she can schedule a call?
Sure, that would be great.
Okay, Carrie, I'm putting her on hold. See where we can plug this dear lady in for some phone consult. JC, thank you very much for calling.
Thank you so much.
Bye-bye. Well, that was phenomenal. We had a phone caller.
Yeah.
Wowee! Can you come over more often?
Yep.
Wow. Red letter day. Do you have anyone right at 1?
Yes.
You do? Well, you gotta go.
Okay. You guys finish it
It's
up
1
then?
o'clock. We'll finish it up. We'll do the conundrum
Perfect.
for this week.
It was very nice meeting you.
Nice
I hope
meeting
we
you
get to do more of this. Thank you, Mo.
Thank you, Doc. And we're okay because we're 6 feet apart now.
Yeah. The space is back. See you guys.
Teresa, Alan, and Todd, we will get to your questions next week, and anybody else that might be trying to call in, we'll get to your questions next week. If you have questions between now and then, you can email them into info@Siloam Center, leave it on the questions or comments, and send smoke signals, carry a pigeon. So are you ready for this week's conundrum?
I am.
Carl Bedwetter. Don't snicker. There's no T's in that name. It's Wedder. Poor Carl. I'll bet he's had to deal with this his whole life. Can you imagine how hard junior high would have been with a name like that? Carl, go ahead.
I assumed you changed it for anonymity.
I just made it up. Carl Bedwetter was just back from a brief 3-day soiree in Omaha, because it's a wild town. He had decided that because he might never get back to the bright lights of Omaha again, he would hit the deli section of the local Marvin Macy's grocery store and spend his meals grazing the Grand Buffet. Now you know he's a high roller. Being a student of buffets and having sampled their wares at grocery stores and casinos all over the Midwest and the greater Las Vegas area, Carl was as happy as a clam. He had a particular fondness for those exotic morsels that are buffet sushi rolls. Wow. Huh. Who was the lady in our conundrum a couple of weeks ago that was driving a 78 Lincoln, or no, a 78 Olds Toronado? Carl, you should meet her. Now, after 3 days of subsisting on mainly imitation crab sushi rolls, Carl was in trouble. He hadn't had a bowel movement in days and none on the horizon. He felt a growing sharp pain in his gut and he couldn't really point to where it was, but he knew it was there. His sister, a nutritionist and herbalist, rolled her eyes at common reaction and told him that he ate too much pseudo crab sushi and now he had this Chinese pathogen striking his bowel. What was the pathogen and what is he at risk of? If you think you know the answer to either one of those questions, it's a two-part question, which means we have the potential for having two winners. Write it on a postcard and send it to us. Chat with the Docs, care of the Siloam Center, 839 Harding Street, Janesville, Wisconsin, 53545, or email us info@siloamcenter.com. And we are out of time. In fact, we've gone long. But Dr. Rebecca, thank you for coming. This was a riot. We have to do it again sometime when they let you out.
Thank you for having me.
Thank you. Thank you for coming. On behalf of Dr. Noel, thank you. On behalf of all of us at the Siloam Center, thank you for watching and joining us, all three of you. Woohoo! And thank you, JC, for taking the time to call in. I hope it was helpful. Until next week, shalom and be well. Okay, and we're going to go mute and let it play out just a little bit before I kill the camera.
Okay.
So that way, if he gets the